All right, today we're doing a male pellet procedure, and I've set up my sterile field here. I've actually dropped all of the 200 milligram pellets onto the sterile field with my instruments, and I'm going to go ahead and put the blade on the field too. And the rest of what I have here is I have my steri strips, tincture of benzoin, and the cover up to complete the procedure at the end. I have my chlor swab to clean the field once I get started, and then I actually have 3 syringes of lidocaine. I have 8 cc's of lidocaine with epinephrine, 2 cc's of bicarb in each syringe. When I do a male procedure, I have 8 cc's of lidocaine with epinephrine, and then I have 2 without epinephrine. So I don't give 3 10 cc syringes with epinephrine, only 1 10 cc syringe. So the first thing I'm going to do is just mark out where we actually want to put the pellets. So you just take the top of the buttocks crack, and then you find the greater trochanter, and you just kind of draw an imaginary line between the two. And on men, we actually want to find the midpoint and then come back from the midpoint, and that is going to be our insertion site. I always kind of feel the area from in because you want it to be going into more of a soft area. So you don't want to get it too high up in the muscle, and you don't want to get it too low. So if this is the imaginary line, our insertion site's probably going to be here, and the pellets will go in here. So I make a little X where the insertion site's going to be, and then I draw a line. For men, there's 3 tracks. So I actually just draw the track lines. Not everybody does this, but for me it gives me some idea of where I'm going. And then what I do is I like to pull down on the skin before I insert the needle, and I always say you're going to feel a little stick here. I pull back on, and this kind of helps defer a little bit of the pain of the injection going in by pulling back. And I have the bevel up because I want to make a little bleb right here where my insertion site is, where you're actually going to make the, going to feel a stick. And everybody always jumps. So I've just got my bevel up, and I'm going to make a little, you can see a little bleb there right at the insertion site. And I always tell the patient, you're going to feel a little stinging going in, and you're going to follow the tracks with the lidocaine. 30% angle here. You can see the difference between the skin and where the syringe is. You don't want to be flat, and you don't want to be standing up. You want to be at 30 degrees going in along the tracks, pushing in as you go. And you actually want to get it all the way to the end of the track, so pushing in the bevel at the end. Again, putting a little bleb here and then following the track. Don't be alarmed if you see this all, it'll distribute pretty quickly. You okay? You should be pretty numb by now. Typically, men don't have a lot of subcutaneous fat, so it's a little bit more challenging at times to put many pellets into the subcutaneous area because there's just not a lot of fat to work with, unlike us women. I have a tendency to really want to kind of move this around, and I think it helps distribute the lidocaine into the tissues. You don't have to do this, but it seems to work well for me. And then before I put my sterile gloves on, I just clean the area with the chlor swab, moving out around the field. then I'm putting on the sterile gloves now. And then I just basically set up my field. So I take the one sterile field, which is my glove field, and I put it right here. Again, you don't want to be dropping the pellets. The pellets are very expensive, and you really want 2 sterile fields. So I put my gauze pads down here, and then I pick up the pellets, and I always do a double count. So I make sure that my pellet count is correct when I put them into the stainless steel cup. You're giving the lidocaine some time to work. Everybody seems to develop their own way of doing this. It's just kind of how I've developed the way that's most convenient for me. I put the trocar together, and again, they're married sets, so it clicks right in. Make sure it's clicked in and ready to go. Take your blade, and you're gonna make a little bit wider incision on a man than you do on a woman, but again, you're making at the base where the bleb is. Can you feel that? I always ask that because sometimes people take a little bit longer to get numb. So I kind of put the blade in about halfway down. That's about as much as a male needs, as a woman is usually back here. And then you take the trocar. I always start with this one first or the middle one. So you want to pull back on the skin here, and you're going to insert it almost like straight down just to get it in. So pull back, go in just to get it past the skin, and your bevel is actually up. And then you've got to, men are a little bit tougher to get the trocar in there. Holding back here with your gauze, and you're twisting. You can see that I'm twisting and pushing, twisting and pushing. Don't worry, you've put 30 cc's of lidocaine in there, so they're not going to feel this. So this is the part that's quite different than women. Once you get it into place, and the trocars are different sizes, so this is a little bit longer one, so I'm not putting it all the way in. You take the bevel out, the plunger out, and then you take your pickups and you leave the cup underneath the trocar, and you load the pellet in. I put it in, push it in. And you need to put them in, again, you're holding the trocar in the line. You don't want to be moving it around 30 degrees. And the first pellet's going to go in right at 12 o'clock. So you can see the opening's at 12. You push it in. And then you're going to do the next one at 3 o'clock. Again, moving your trocar in the line of where you're going. So I'm turning it to 3 o'clock, pushing it in. And then we're going to do 9 o'clock, putting it in line, turning it to 9 o'clock, pushing it in. I will tell you, this one is making it look easy, but some of the male pellets are, you know, if they have very fibrous tissue, it's a little bit harder to push them in. These are actually going in quite easy. I'm turning this one to 6 o'clock, so all the way down, and pushing it in. Now we're done with this track. We've done the whole clock on this track. So now I'm taking the plunger out and putting back in the sharp one because we need to go down a new track, locking it in, pulling it back just as far from the end of the pellets, and then we're going to change directions and go down this track. So we're going to push. I don't go quite as far on this track. It's just, again, one of those things I've kind of identified myself that works well. This is why you put the cup underneath. I don't know if you just saw that one drop, but at least it will drop into the sterile field. So we're going to go in at 12 o'clock, this track here. And sometimes you have to move it around, so this one's a little bit more difficult to get in. go. So again, just changing positions, sometimes it's a little bit more fibrous. So we're gonna go, you okay?
Yeah.
We're gonna go, this time we're gonna go to 3 o'clock. Now we're gonna go 9 o'clock, staying in this track here. And then we're gonna, our last one in this track is gonna go to 6 o'clock. Sometimes you hear a little bit of a snapping sound like you just heard there, and that's normal. So I took the plunger out, put the sharp blade in. We're gonna go in the last track now. Click it in, pull it back, and we're gonna advance to this one. You okay?
Mm-hmm.
I always ask if they're okay. You'll probably know if they're not, especially if all of a sudden they start feeling something. $12 o'clock. Again, moving it around to try to get it pushed in. If you meet resistance, you kind of have to push it a little bit. Did you feel that?
Yeah, a little bit.
3 o'clock. If they feel it, you can always pull it back a little bit and get it back into the area that it's not uncomfortable. Like I'll pull this one back just a little bit and it just slides right in. So sometimes you have to kind of play with it a little bit. You don't want to get any of the pellets close to the incision though. You want to keep them far away. This is the last pellet and we're going to go at 6 o'clock and we're done. So now you just take your gauze, hold it over the incision and pull the trocar out. Then I take the tincture of benzoin, put it on the incision, around the incision, and then I use the steri strips to close it up. Sometimes with men, I actually use 2 steri strips. This one closed up real nicely, but sometimes I'll put one right next to it just for reinforcement. I always tell male patients these steri strips need to stay on. I might actually even put another one on him. These steri strips stay on for 5 days. They can get wet. The pressure dressing on the outside will stay on for 48 hours. Women is 24, but men is 48. We use these little cover-up things here and they're awesome. And I put a little bit of pressure on there. So I usually, if you could take your hand, I'm gonna have you feel this. This is the outer dressing here. That should stay on for 48 hours and not get wet. If you need to take a shower, then just cover it up with plastic. You can peel this off after 48 hours and the steri strips need to stay on for 5 days. There's no antibiotics that we use. This is a sterile procedure. Never had any problems with infection. And that is it.